What better way to celebrate the month of love than cherishing your heart? This hour we have Northwest primary care physician at West Creek, Dr. Zeeshan Mahmood. He's also representing the American Heart Association. He joins us now to share small lifestyle changes that make a world of difference. And welcome to our show.
Thank you for having me.
Now, of course, a lot of people just take their heart for granted until something goes wrong. And you find that in most cases, right?
Yeah, in most cases, because there's many risk factors out there for heart disease, and as a primary care physician, we try to educate the patients on the risk factors for heart disease and how to reduce those risk factors.
What are some of the early warning signs that people need to take heed about?
Again, we kind of base it on risk factors. Obesity is something you got to watch for. Lifestyle changes they can make with dieting, losing weight, that's an important thing. Smoking. That's a big risk factor, so we always recommend, smoking cessation. And then some of the other stuff is just medical conditions, comorbidities, diabetes, big risk factor for heart disease. High cholesterol, that's something that we always watch for, and uncontrolled blood pressure. And then also another risk factor, an important one, is family health, family history, knowing what your family history, heart history is.
Let's take a look at some of the small things people can do. And number one, look for short breaks each day. That's important.
Yeah, that is important. It's just important to keep yourself active. You have breaks throughout the day instead of going out and, smoking a cigarette. Why not take a little walk, take a little break, just get your body moving around. That always helps. Okay,
and especially if you got a sedentary job.
Yeah.
Take the Go Red Heart Checkup, and that's online.
Yeah, that's part of the American Heart Association. They actually, it's the Go Red for Women campaign. They have a online checkup where they basically go through the risk factors, and patients can go online. It's goredforwomen.org and go ahead and fill it out and take it to their physicians.
Okay. Next one up, plan quick and simple healthy meals, and I guess the key word here is healthy, right?
Yeah, exactly. It's just making sure you prepare some healthy meals, quick little snacks, fruits, vegetables, getting the healthy meals in throughout the day, All
right. And lastly, but not leastly, know your family heart health history. You mentioned that
And like I said, that's a big risk factor. You got to know what your family history is with heart disease, and, as a physician, it's a big risk factor for us. If you had people in your family who had early heart attacks or early heart disease,
What's more important for your heart health? Is it diet? Is it exercise?
It's a combination of both. It's kind of a hard question.
I knew you were going to say that.
Yeah, it's a combination of both. You got to do both. As HCA physicians, we look forward to working with the American Heart Association in this Go Red for Women month. The campaign is basically to empower women, to teach them, to educate them on heart disease. This notion or myth that heart disease only affects men, it's a men's disease, or only affects males, we need to clear that out. 1 in 3 women each year, American women, die of heart disease, compared to 1 in 30 for breast cancer.
And if you had a hysterectomy, does that up your chance of having heart problems?
It may. Again, it depends on comorbidities, risk factors. I keep mentioning the risk factor, but another statistic, interestingly, is over 90% of women, American women, have at least one risk factor that I discussed in regards to heart disease. So again, it's something that women need to be educated on, men as well. And as a primary, that's what we're there for, is to help reduce these risk factors. Of
course, for more information, you go to the website, correct?
Yes.
Online, and it's American Heart Association, or Go Red for Women. And again, one of the things I guess we have to, if you were telling the women out there, make one lifestyle change, what would it be?
Again, because there's so many risk factors, it's hard to just say one, but combating obesity, weight loss, that would be important.
Keeping your weight under control.
Keeping your weight under control.
And that affects a lot of things, your heart, as well as other organs as well.
And yeah, many other comorbidities, leads to many other comorbidities too. So.
Okay, well, thank you very much. There are many other ways you can love your heart, including tips for women at work, moms on the go, and jet-setting ladies. We made it simple for you by posting them on our Facebook page and website. Look us up under Comcast Newsmakers South Florida. I'm Spiro Canton. Thank you for joining us.